Hello and welcome to our video where we will be introducing you to a low potassium diet. This video is aimed at anyone who has been told by their doctor, dietitian or nurse to follow a low potassium diet due to their kidneys not working properly. Potassium is a mineral which is found in some of the foods we eat. It is used by the body to help control muscle movement. In particular, it's used by the heart to keep the rhythm regular. The level of potassium in the blood is controlled by the kidneys. When kidneys are not working properly, the potassium level in the blood may rise. It is quite common for people with kidney problems to have too much in their blood. This can happen in the later stages of kidney disease and when someone is having dialysis. Dialysis works as a filter to remove toxins, but does not work all hours of the day like a working kidney would. Too much potassium can be dangerous as it affects the rhythm of the heart and can cause a heart attack if levels are very high. There is no reliable way to tell other than a blood test if potassium levels are high. There are 3 ways to control your potassium levels. 1. If you are on dialysis, keep to your scheduled sessions. 2. To ensure regular bowel habits, as your bowels will also remove some potassium. And 3. To follow a low potassium diet. Potassium can be found in a number of food groups, which include fruit and vegetables, potatoes, dairy products, some drinks and alcohol, sweet and savoury snacks, and offal. Suitable foods to have when following a low potassium diet would include cucumbers, red and green bell peppers, tinned mushrooms, and most boiled vegetables. From fruits, you could have apples, oranges, pears, and tinned fruit. If you were cooking, you could cook with garlic, all herbs and spices, oils and spreads and butters. From starchy foods, you can eat brown and white bread, pasta, rice, cereals, but make sure these do not contain dried fruit, chocolate or nuts. Boiled potatoes are fine as long as they are no more than 3 egg-sized potatoes and the skin has been removed and they are boiled. Drinks, you could have fruit cordial or squash, water, tea, fizzy drinks and spirits. Protein sources would include meat, fish, poultry, eggs and dairy products. Please make sure you're not having more than half a pint of milk a day. Corn and tofu are also fine. When following a low potassium diet, the main foods to avoid from vegetables would be fresh beetroot, spinach, pak choy, sun-dried tomatoes, endive, Swiss chard, aduki beans, canned bamboo shoots, tomato puree, dried mushrooms. From fruit, be careful with dried fruits, fruit juice, avocado, bananas and coconuts. When cooking, try to avoid any salt substitutes such as low salt or solo as these contain added potassium. From starchy foods, avoid any unboiled potatoes such as chips, jacket potatoes and potato crisps. From your protein sources, be careful with drinking too much milk through the day or having yogurts or offal or pate and nuts and seeds. For drinks, be careful with fruit juice, coffee and hot chocolates.